I'd like to go back to the registry. I've been on it for, I don't know what, 10 years maybe? How long is it? You mentioned that you're starting to get some results out of it, and I'd recommend anybody and everybody to, what is it, you fill out the form once a year,
yeah.
And I notice I've really evolved just looking back mentally. Are you finding results and trends?
Dr. Statlin, Jeffrey Statlin, and I think I have on my next 3 slides, I think I have references. And I'm more than happy to share these with June and, you know, have them available to you. Where is it? Statlin, on this slide, if you see risks of functional impairment in FSH, that's where they looked at the registry data to look at how many patients change how much over time. And as I said, we've just started publishing data both in myotonic dystrophy and in FSH dystrophy. Besides the CDC guidelines that are on this www.health.gov page, there's something called the National Center on Health, Physical Activity, and Disability, which is based out of Alabama, and it's funded by the CDC, and I would strongly urge you to try and look at that website. Actually, they got funded, I think, by the CDC 3 years ago to work with people with different conditions, and on their website is a program where you can go in, register, you get dietetic information, exercise program, etc. At least check it out, okay? Because they try and work with people with different kinds of conditions and how you might adapt your exercise and activity programs. So that's something, and they have desk exercise and all kinds of exercise for people with mobility problems, and they have a monthly newsletter. So if nothing else, you know, if you just want another resource to have, that's something you may want to at least look at. And then there have been a couple of reviews lately on exercise and neuromuscular disease, and that's, you know, basically though, the unfortunate part is that, you know, people expect to use the gold standard that's used for pharmaceutical therapy for exercise and activity kinds of trials. And that's going to be very, very hard to do and very, very hard to fund. And really, you almost need a study of 3 to 5 years. And that's not going to happen. We know that. And this is why I think, in June and I have talked about this, you know, people have talked about a website called
Patients Like Me.
Patients Like Me, where patients started out, I think, with the person who had a family member with MS, and, you know, people with MS are putting in all their information. And I understand and appreciate those sites, but then we have to be very careful about the data that goes in. And if we all have different definitions of what something means, I don't care how much data you collect. Garbage in is garbage out. Okay? So if we are going to embark on something like that, we as a larger group have to come to a consensus on what it is that we are interested in looking at. How exactly are we defining it? How are we measuring it? What kind of data we want in, etc. And I'd be more than open to an effort like that, but I think it needs a lot of thought. Otherwise, it's going to be garbage in and garbage out. But there are, I mean, in this day and age, you know, with all the electronic devices, people can measure everything that they want. Your mood, your health, the distance you walk, the calories you burned. I mean, we are in a truly, truly interesting age now, and we don't have to rely on the old ways of doing exercise studies or active studies. So there are a lot of opportunities. Sorry, took a long way to answer your question there about the registry.
In my family, there are a lot of
anecdotal stories among people affected with FSH about it, working, having a perfectly smooth period of time, and then you do something like move or have some acute event that causes a change in the mobility or range of motion for a particular area of your body. So without monitoring CKs as you do everything, how can you define sort of what the standard operating range for your body is, and then understand when you have crossed that threshold, what it is that you might do? I mean, I'm not very affected. Other members in my family are not particularly affected, but we like to understand what the limits are.
Okay, so let me say one thing. Strength and function relationship, and this is a very interesting question because people come to us and say, I was doing perfectly fine, and then I don't know what happened. I just couldn't do this. It just seems like something happened and I took a dive. In our natural history of FSH, we did in 1990 and followed patients for 3 years, and we tested like 21 muscle groups. What we found is strength goes down very slowly. It takes almost 2 years of good measurements to detect a change. But what happens is, and I know that strength can be going down, our bodies adapt, and we can continue to function. But there's a critical amount of strength in a certain muscle to allow us to function. And boom, it might take only a half a kilogram of force generating capacity. When we go from able to not able to generate that small amount of capacity and we cross the critical threshold, and suddenly we are not able to function anymore. And if you have other factors that happen at that time, and I'm not saying that other factors don't affect function, like, having an illness and staying in bed for 3 days, whatever. But it's that strength-function relationship is very interesting, that it's not parallel, it's a dip in terms of function to strength. And that's true, especially in these slowly progressive disorders, where our bodies just adapt and adapt and adapt. And at some point, they've lost all the game that they had, and now it just affects them. So that's one explanation for the strength-function relationship. Does that help?
Right.
Any other? Yes, please.
Back to the registry. I heard about it last year at the FSH conference, and I think I went on the website once and it seemed very complicated. Could you just tell me where is that site again, and what's the process for registry?
So if you Google MidAtlantic and FSH Registry, and I'll be more than happy to take your name, address, phone number. You can request a packet, and when you first enroll, I know it's not that easy because they ask for medical information because they want to know if you had genetic testing and all that kind of stuff to make sure you truly have FSH. But then once you're in the registry, it's very simple. You just update. They'll send you information every year to see how much you have changed, and that's the easy part. Okay? But I'd be more than happy to take your name and contact and make sure someone gets back to you. I appreciate your interest in the registry.
Is there any study as far as what works better, whether it's aqua therapy or massage therapy or hypnotherapy? Is one? It just depends on the person.
And what I would say is,
We could do a study on that.
I wish it was a simple study. It would have been a long time. It would have been done a long time ago. But I would actually suggest to you that different things might work best at different points in time for each patient. Okay? And really, so I do not discourage. If someone feels massage helps them, more power to you. Use that. Pool therapy works for me, great. Stay with it. Whatever helps you, whatever you can incorporate in your life, go for it. Everything is best.
Shree, if I could just expand on why I was laughing, is that Elba, Harina Maldonado, can you raise your hand? She's a relatively new fellow to Kennedy Krieger doing clinical trials in muscular dystrophy. And as you well know, Shree, but the group doesn't know, she's just applied to the MDA to do a pilot grant to try to gather information. Her study is going to be relatively short term, and I completely agree with you. To get the answers to this, we're going to need to do some long-term studies. So she's going to do a study comparing land, water-based therapy, and massage therapy in FSH, assuming it gets funded. You may be hearing from us, and Lynn has already decided she wants to do massage.
So this is where I'd like to speak. Hi, I'm Rebecca. I'm a licensed physical therapist assistant, and I'm also a licensed massage therapist, and I'm a yoga teacher. And in relation to the discussion that Frank brought up, and then this young lady over here, I think they're both really linked, and I think you're correct. There isn't any statistical measurement as of right now. How do we determine what our functional capacity, how can we determine if our body is going to all of a sudden take that dip in strength? I personally and professionally believe it's related to these effects on our nervous system, our immune system, what's happening on that physiological level that starts to affect the communication from the brain to the nervous system, and then therefore what's happening on that strength level. And I would like to participate in trying to find a statistical protocol in a preventative aspect so that individuals can get to know their body so well enough that they can determine themselves, okay, I think this has happened to my body, like I just had the flu for 3 days, so therefore I know if I return to this certain level of activity, I'm more prone to injuring myself, or I'm more prone to not have that weakness. And to come up with those specific protocols, and then how to restore through massage therapy. Is more than just actively, passively turning off muscles. It's also about activating muscles that aren't really working. So there's, I'd like to bring that education to massage too. It's not just a passive modality.
Well, if you can talk to Elba and Carly, I'm just up there sitting right next to her, and we welcome your involvement.
Great. I'd love to be involved. And I really appreciated your speech, and I love the discussion of working as a team, because I really think that that's really the only way to get that quality care and help individuals improve the quality of their life. Thank you.
Thank you. Any other?
Are there any online questions, Tom?
We don't have the best environment for it today, but so I haven't interested in.
I'm used to getting questions, so I will accept questions by email, so that's fine. And again, it's hard when people ask me for individualized recommendations, and I can only give them general things that I have said, and say that you need to build a relationship with local people for that individualized plan of care. So thank you again for having me.
And I'd like to just conclude the sort of formal part. You're welcome to stay and talk to Shree, myself, Elba, Carly, Don, Lillian, among each other. And I'd like to thank Kennedy Krieger for providing this venue. I'm very sorry about our technical problems, and we will get them fixed for the next time. And thank the FSH Society for providing a grant to allow us to do this and to bring in speakers such as Shree. Though she probably would have driven down herself and done this for nothing. But all right, thank you all.
Thank you.